Finally, Uganda government has constructed a hospital that is at par with World Health standards, which will treat presidents and other visiting dignitaries in case of an emergency. The facility, which has been long overdue, comes after government learned the hard way, with dignitaries dying in the country after failing to get the required care.
And many of the epidemics, SARS, influenza, are handled by us as a hospital. And we have been handling prime ministers as well. So this VIP launch was specifically put there to handle these very important visitors of the country, within and outside the country. So the launch basically having an accommodation area which also puts security as part of it.
Dr. Muwanguzi adds that the hospital, which is a few kilometers away from the international airport, has an allowance to house president's bodyguards and bedrooms for their caretakers.
The bed is here. Now when the patient is on the bed and has a problem, you don't shout, you just press the bell. Then the nurse will know that the bell will ring, and the nurse will know that bed so and so.
The health workers handling the very important persons will equally be different from those treating the layman.
We have some specialized doctors and nurses who will be attached to that department to handle these VIPs. But I think our location, it may be unique to other hospitals, they don't have that, but it was necessary for us that we need to have that in mind, that we are near State House and we have to handle such guests.
The facility, which is now 104 years old, was upgraded to a regional hospital in 2008 after combining both Grade A and Grade B departments. Entebbe Grade A was created in 1904, while Grade B was born in 1918. By the nature of its location, it has a catchment area of more than 1.5 million people. Patients from all islands around Entebbe, plus all the highway accidents and emergencies, not forgetting the incoming visitors from Entebbe International Airport. Apart from the VIP services, Dr. Muwanguzi confirms the new hospital will boost the safe maternal services, since they now have 2 theaters for mothers who need C-section services.
The hospital has a wide range of staffs, doctors, nurses, paramedics, orthopedics, theater services. Apart from the inpatients, we also have theater services, and basically we have quite many mothers who come from the islands and the nearby areas who come for cesarean section. We have noted that many of our mothers are young mothers in the community, and by the time they come, they can't make it really to deliver, so they end up being sectioned. We have antenatal services, and we really monitor these mothers.
He also confirmed that they receive close to 500 mothers each month, but 15% of these require C-section. Unfortunately, most of these are young mothers who have not mastered the importance of early antenatal care, especially those coming from the islands. Such mothers are victims to eclampsia, commonly known as high blood pressure, which claims many mothers' lives. I am Fatuma Nalanga for Urban TV.